Hello, first year faculty team. This is our video for our week 10 updates. So we now officially have 6 weeks left of clinic. The first year students are doing an excellent job. They really are working hard and are getting lots of things completed in a very timely manner. Some things to keep on your radar this week are the calculus detection skill evaluations. If a student has got 45 minutes available without a patient in the chair, they really should be getting the mannequin evaluation completed. Remember, you just set that up, the student does it on their own, and then they'll submit it to me for grading on Blackboard. For the patient calculus detection, the next patient they've got in their chair with moderate calculus, whether that's localized or generalized, they really should be thinking about getting this done just in case they don't pass it the first time, so that they'll have another opportunity to take it, since it is patient dependent, calculus dependent, before the end of the semester. For this one, it can happen either before check-in or after check-in. It just needs to happen prior to any scaling procedures. So for the mannequin, if that one is not completed by the end of next week, I am going to be scheduling them into the opposite clinic just to sit for a few minutes and get that completed. That way they don't have to take away their patient time in order to get it finished. Another skill evaluation to kind of be aware of is the OSCE. They used to do the OSCE during clinic time. It was required. It's now optional. They can either do it on their own time or they can do it during clinic. They are recorded as usual when they take it. If they do decide they'd like to take it during clinic at a time where they don't have a patient in their chair, please have them take it in the processing room because it's a little bit quieter back there. They don't need the password. You don't need to give them instruments or anything like that. They just need kind of a quiet space to take it. So you'll move them into the processing room if they decide that they're going to do that. I've also instructed the students to think about who they might like to use for their patient care plans. So you may hear a little bit of discussion about those. Those are taking place on Tuesday, April 21st during the morning clinic, and then Thursday, April 23rd during that morning's clinic. A few other things to be aware of. We're watching time management. We're not, this isn't a punitive procedure. It's more of a guiding the students along and making sure they're being efficient with their time. I'd also like when you're scanning the schedule for the day, if you see the provider for the patient is listed as Lakeland Community College, that means the student forgot to change themselves to the provider. So if you could please give them a reminder to do so, we would appreciate it. Patient charts are due the day the student completes the patient, even in an evening clinic. Those must be turned in same day. It really doesn't take a long amount of time to get the chart organized and submitted. And so they should have plenty of time within the SARP time to get that done. So please make sure that the student turns their chart in the very same day. Also, when you're checking signatures, please check the signatures carefully. We did have an adolescent sign a couple of forms last week. So please just make sure that if the patient is under the age of 18, that the parent or guardian is signing those forms. On Thursday of this week, there are no clinics. So you do not need to be here for clinic sessions on Thursday. The students are going to be learning some additional patient education things that weren't touched on in great detail before. So they're going to be learning more about electric toothbrushes, mouth rinses. I'm going to rediscuss the active ingredients in toothpaste. We'll talk about oral irrigators, revisit motivational interviewing and self-care instruction, and how to work with patients individually on their needs. They also have a lunch and learn that is scheduled for noon on Thursday. Millie Venus from Oral B will be here to discuss some different Oral B options with the students. That is all that I have for you this week. If there's anything that you need help with, please do not hesitate to reach out, and I hope you have a really good week.